my name is Mengel. I work for Metanova, scientific innovation. We work in Africa on low-cost and high-impact solutions to medical problems in remote areas. So I'm looking for a device that can bridge the gap from the field to the experts. So basically, what we need is to have field workers that are often unskilled or have little medical training, and most of the time no advanced studies in medicine or biology or other relevant fields, to be able to access data repositories or image repositories that allow them to compare what they see in the field with what experts or let's say what other entities have been able to collect as previous reference images or opinions. So as a concrete example, you would have a lab technician that would be looking at a biological sample under the microscope, and he would like to see if the germ that he is seeing under his microscope or the blood smear compares to a certain diagnosis that has been made previously. So with the adequate software, he would be able to answer that question in a comparatively short time. And especially important for, say, the health systems in the countries concerned would be that they would skip the step of having to construct permanent infrastructure in a remote area. So for example, if you had a device like a mobile laboratory with which people could go to the field and collect pertinent samples, you would not have to go through the entire process of constructing a lab, and especially you would not have to allocate scarce human resources permanently to a certain place which might not have such a high person turnover. Instead, you could establish rotational schemes that can cover a much larger area and many more potential patients in a much shorter time period.